Hi, Dr. Terrell Joseph, Vail Summit Orthopedics. I wanted to talk today a little bit about fractured elbows and common elbow injuries. In general, elbow injuries are not that common compared to the wrist or the shoulder. It tends to, when you land off of a fall or an injury, you tend to, of course, land on your wrist. Sometimes patients do land directly on their elbow, and if they land directly on their elbow on ice or something really hard, then you can have fractures of that elbow. Common fracture in the elbow is called the olecranon, and that's this bone right here. It's the kind of the tip of your elbow, and when patients land directly on it, it can break and fracture just like this one right here. And they're pretty obvious injuries. Patients know when they break that, the triceps muscle attaches there and they don't have any good function and it really hurts them a lot. And so when we see these need to be fixed. Another common injury in the elbow is patients can fracture what's called the radial head. And it's a little tricky because they fall on their wrist, but they have elbow pain. And the reason is that when you fall on your wrist, the energy goes up this bone called the radius, and it'll break this radial head right at the top here. And it's pretty common that we see these, and not from even a big injury. It can be just a real hard, firm fall, and then patients have immediate elbow pain. The clue to this one is this radial head is responsible for twisting your wrist. So if patients twist their wrist and they have a lot of elbow pain, then we're thinking radial head because they're twisting this bone here that can crack very commonly. So that's just a clue. If you have a fall on your wrist and you have elbow pain, it can be a fracture even though you landed on your wrist. Separately, there's a bunch of ligaments that attach in this area, and sometimes from more of a weird twist that makes your elbow twist side to side like that, that can tear the ligaments on the side. The good news about elbow ligaments is they're predictable healers. We usually don't have to fix them. And the last injury I want to mention is an elbow dislocation. And sometimes patients, when they fall, the entire elbow, the joint itself, will dislocate. It's obviously very painful, and it's quite obvious that it happens, and most of those patients go to the emergency room. So if you're worried that you have any kind of a persistent elbow injury, come see us, the experts at Vail Summit Orthopedics. Dr. Joseph.